Hello, this is Dr. David Green, Education Director for Premier Pain Specialists. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks, although an unfortunate few will end up with chronic back pain. So the definitions are acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and chronic is anything over 3 months. It's the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. It's the most common cause of worldwide disability, and the direct or indirect cost of back pain is about $100 billion a year. So what are the causes? I've divided them into soft tissue causes and hard tissue, bony causes. The first and most common soft tissue is a back sprain or a strain. This could be from anything really, even a sneeze or when you're moving on a weekend or something, weekend warrior activity, what have you. A sprain refers to a ligament, so you may stretch or tear a ligament in the back, or you can strain a muscle, okay? The second is disc degeneration. So here on the left you see what a normal disc looks like. A cartoon of it. Here's the annulus fibrosus, which is the outer layer. Here's the nucleus pulposus, which is the inner gelatinous layer. There's no nerve endings on the inner layer. Only the outer annulus has nerve endings. As your discs degenerate with normal age, here's a healthy disc. You start to lose water and get compression and bulging of degenerative discs, and that can actually cause tears in this outer part and back pain. Here you have a tear, okay, in the annulus, the outer layer. That can cause pain, all right? That's part and parcel of degenerative disc disease. 40% of the time, a disc is the source of someone's low back pain, okay? Here you have a disc herniation, which is where a piece of the disc is herniated out, and it's pinching on a nerve root and causing sciatica. Sciatica, the sciatic nerve is a conglomeration of 3 nerve roots, L4, L5, and S1. They come together, they go down the back of the leg as a sciatic nerve. If someone has pinching with either a bulging or herniated disc on one of these nerve roots up here, it will cause pain down either the back, the side of the leg, sometimes down into the foot. All right, let's move into the bony causes of back pain. Arthritis, far and away the most common bony cause of back pain. What's happening is the disc is where it all starts. That degenerates, it shifts stresses to the back part where these joints are. That can cause arthritis because they have cartilage just like other joints, hip or the knee. You can get bone spurring, narrowing of the disc, degeneration and overgrowth of bone in the joints in the back. All that can be painful. Sacroiliac joint pain in the back where the sacrum meets up with the ilium, which is the pelvis. You have an SI joint, a sacroiliac joint on the right side and on the left side, okay? They have cartilage just like other joints. They do see some movement, and they're prone to arthritis and pain. All right, scoliosis in adult is referred to as adult degenerative scoliosis, and that can cause pain because of the arthritis associated with it, and it can also pinch on nerve roots and cause spinal stenosis. Spondylolisthesis is typically from spinal degeneration when one vertebrae starts to slip on the one below it, okay? That can pull traction on nerve roots. It can also have pain from the arthritis in the low back, so it can cause back and leg pain. Spondylolysis is basically a stress fracture of this bony area. It's called the pars, okay? It's mostly seen in younger individuals who are engaged in, let's go back to that, who are engaged in repetitive activities such as football linemen, gymnastics, things like that. Rest usually helps a lot. In last resort, this can have surgery where you fuse that bone back together. And then spinal stenosis is where you have bony overgrowth, okay, and soft tissue overgrowth due to degeneration. That can cause some back pain. It can also pinch on nerve roots as they're trying to get out from the spinal cord column and cause leg pain, back pain, buttock, and thigh pain. Uncommon causes of back pain, infection, which can either occur in the disc space or in the vertebrae itself. Fracture, actually it's not that uncommon. A vertebral compression fracture happens about 1 million times a year. and can cause significant back pain, and then a tumor. Premier Pain Specialist offers the top non-operative pain management in the metropolitan Chicago area. There are several clinics throughout the region, accepting over 50 insurances, providing over 25 treatment options, and exceptional success rates with the board-certified, fellowship-trained, award-winning pain doctors. Visit us today online at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you for watching.